Hello, everyone. This is Janet Hill at the Rock Island County Health Department. Thank you for joining us on this beautiful, warmish, sunny day. It is 3:30 p.m. on the 23rd of February. Today we have Nita Ludwig of the Rock Island County Health Department and Edward Rivers of the Scott County Health Department. They will be talking about some vaccine campaign updates. Nita, let's start off with some Rock Island County numbers first, please.
Good afternoon. Today we have 8 new cases of COVID-19 in Rock Island County, bringing our total to 12,792. Currently, there are 19 people hospitalized with COVID-19 in our county. And unfortunately, today we are reporting 2 deaths from COVID-19, a woman in her 90s and a woman in her 80s, both of whom have been hospitalized. And again, we always offer our sincere condolences to all those who have lost loved ones during this pandemic. Thank you.
In Scott County today, the Iowa Department of Public Health reports 18,232 cases and 204 deaths. You may note that that number is quite some number larger than we reported Thursday. Our talking points will explain why.
So we have heard the stories too about the links people go to get a coveted time slot for a COVID-19 vaccination appointment. And we understand that checking all these websites is stressful and feels times and opportunities will become more plentiful. We're just not quite there yet. The health department and our healthcare and pharmacy partners have one request. Once you have a confirmed time slot, please don't look for another one. This time slot and dose are reserved for you. So double booking slots, just in case, takes away an opportunity for another person to get a vaccination spot. Calling and canceling your slot also forces a scramble to fill it as quickly as we can to make sure that no vaccines go to waste. Please accept your time slot and try to keep it at all costs. We also ask that you remember to bring your vaccination record card with you after you got your first dose to your second dose appointment. This helps your provider verify the appropriate time interval and what manufacturer you received on that first dose. Illinois Department of Public Health officials on Monday told us that we would soon see more vaccine coming into our community. The emergency use authorization for the 1-dose Johnson & Johnson vaccine could come as early as next week. Just think about how another vaccine might change up the landscape, especially one that requires only 1 dose. This vaccine has been shown to prevent 85% of serious cases and hospitalizations and 100% preventing deaths where it has been tested. If approved, the 3 available vaccines will make herd immunity possible, and maybe even by late this summer. All 3 vaccines will combine to get us through to the other side of this horrible chapter in world history. In the meantime, let's celebrate that almost 22,000 doses have been given in Rock Island County. The State Health Department updates these statistics on Friday, so we know that even more people are already starting to build immunity from vaccination given since Friday. During these trying times, we understand that it's hard to keep the plight of others in mind, and we're all suffering. Remember that feeling 10 or 11 months ago that we're all in this together. We still are, and we appreciate that. Thank you.
The Iowa Department of Public Health has made some recent updates to COVID-19 testing information on coronavirus.iowa.gov website. The site will now be reporting total tests conducted, a shift from reporting the number of persons testing positive. During the early months of the pandemic, the state reported the number of new positive COVID-19 patients and the positivity rate daily. At that time, it was very important to understand the people being infected by this new virus. It told us how many new cases were in the state, what their characteristics were, and helped public health target our mitigation efforts accordingly. Over time, as the rate of testing increased, monitoring overall trends in addition to recent activity has become increasingly more important. You can now find information on the total number of tests, which better reflects COVID-19 activity in the state. A larger number of cases was reported over the weekend. However, this was due to the new reporting changes and not a jump in coronavirus activity. As we mentioned before, COVID-19 vaccination data is also available on the site. As of today, a total of 25,800 doses of vaccine have been administered to Scott County residents. That includes just under 14,000 first doses and just under 6,000 second doses. We continue to receive 2,250 doses of vaccine weekly and spread the vaccine out among healthcare providers to immunize the 65 and older population, and to ourselves, Scott County Health Department, to vaccinate the Phase 1B Tier 1 priority groups. We expect to receive more information in the next few days about what the vaccine supply will look like entering March. And March means spring, which means spring break. We know this has been a long, long winter, and nothing sounds better than a getaway. However, travel during an ongoing pandemic isn't without its risks. The Centers for Disease Control continues to report that cases are extremely high and avoiding travel is recommended. They have new travel guidance. For domestic and international travel, masks are required on planes, buses, trains, and other forms of public transportation traveling into, within, or out of the United States and in U.S. transportation hubs such as airports and bus and train stations. For international travel, all air passengers coming to the United States, including U.S. citizens, are required to have a negative COVID-19 test result or documentation of recovery from COVID-19 before they board a flight to the United States. If you choose to make spring break travel plans, we encourage you and your family to plan for these new requirements and also create plans for how you will avoid crowds, how you will ensure protecting yourself from being exposed to others who could potentially be ill, and how you will handle getting sick while traveling or upon your return. We have finally found ourselves in a more stable point in the pandemic and are on the verge of seeing the benefits of herd immunity, of having groups of people vaccinated in our community. We need to work together to bring our community safely towards the light at the end of the pandemic tunnel.
Thank you, Anita and Ed, for that information today. And we'll give it a minute here, see if any of our media partners have any questions for either health department. Okay, seeing no questions for today, we'll go ahead and conclude the short briefing. We will be posting the recording of this on our websites and on our social media pages, so please check there for additional information as well. And we look forward to talking with you all again later this week. Thank you and have a great afternoon.